You're a parent, you know your kid's ordinary behaviors, and if there's something in your gut that is off, don't wait.
It's a life-threatening issue that needs a fast response. The question is, would you notice the signs? We're talking about strokes and not just in adults.
Signs are often missed in children because it's not even top of mind, even for doctors. WHAS 11's Brooke Hash shares Ezekiel's story here for you tonight, hoping that you'll be better equipped if it ever happens to your child.
That's 8-year-old Ezekiel Nzambi and his dad, Gideon.
He excels, it seems like, in anything he does. So academically, sports, he loves basketball and soccer.
Even as a toddler, he loved playing ball. It's what he was doing the night he had his first stroke.
He was playing basketball in the kitchen. I was cooking some dinner. And all of a sudden he fell, and he fell really hard for just someone who was walking around with a ball. And his cry, it wasn't just a regular cry. It was alarming. As a mom, you get that instinct. Something isn't right.
His mom, Megan, noticed right away he wasn't using the right side of his body.
So I tickled both of his feet, and his left one shot right up, and then the right one it was lifeless, really.
It was downhill from there.
When his speech was very slurred, it was very disturbing just to hear that and just know he's trying to communicate. And he couldn't.
Zeke's parents rushed him to Norton Children's Hospital.
We told them this is not something normal. It needs to be seen as soon as possible.
I just remember I said, you're going to think I'm crazy, but he has stroke symptoms. I said, all the ones, you go to the doctor's office and you see the acronyms, and he had every single one, but you just don't think of a little kid having those.
A stroke happens when a blood clot or broken vessel prevents blood from getting to your brain. It can happen within minutes, but the effects can last a lifetime if not caught early.
They get treated really quickly. We treat it as an emergency here. You can see this.
Dr. Arpita Lakotia said this hasn't always been the case.
If we look at studies from the past 10-20 years, there's always a delay in catching pediatric stroke because that's not the first thing on anyone's mind.
She said doctors are getting better at recognizing the signs, and more often than not, the stroke is caused by an underlying health condition.
Congenital heart disease, bleeding or clotting disorders, disorders of the blood vessels, and then infection can be another one.
Many times the child is diagnosed after the stroke, which is what happened in Zeke's case. Sometimes the fix is as simple as aspirin or blood thinners.
It really depends on what caused the stroke, how big the stroke was, and what sort of deficits they presented with. But in general, kids do way better than adults.
You just have to know how to spot it first.
Basically, if they have facial droop, arm or leg weakness on one side of the body, vision changes, slurred speech, language deficits, any issues with getting their words out, those would be things that need urgent intervention and urgent management. So I would say bring them to the ER.
6 years later, Ezekiel is thriving.
If you met him, you would never know anything ever happened.
He's graduated from his treatment program and ready to tackle third grade.
Let's go, pressure!
And his competition on the field. In Sellersburg,
Good job, Zeke.
Brooke Hash, WHAS 11 on your side.
And pediatric stroke is a rare condition in kids, affecting 1 in every 4,000 newborns and an additional 2,000 older children each year.
So when in doubt, certainly get checked out.